As we've seen in the last few years, a great deal of high-quality research has pointed to the cervical facet joints as a possible source of whiplash pain from low-speed collisions. One question remains. Do these engineering findings correlate with what physicians find in patients suffering from pain caused by rear-end collisions? The simple answer is yes. A great deal of research on the problem of whiplash has been conducted by a group of researchers at the University of Newcastle in Australia. As early as 1988, this group of scientists had begun to look at the facet joints as a source of chronic symptoms. Then in 1996, they reported in the journal Spine their results from an important study conducted on 52 patients with chronic whiplash pain. The researchers gave the patients either an anesthetic nerve block or a placebo to see if the cervical facet joints were actually involved in the chronic pain. They concluded that of these patients, the prevalence of cervical zygapophyseal joint pain was 60%. They found that the most common places for the facets to be injured were the same places where the spine undergoes abnormal stress, C2, C3, and C5, C6. In 1996, research from Japan was published that added weight to this line of study. These scientists examined the pattern of referred pain from the cervical facet joints by injecting each joint and mapping the pattern of pain that was reported. They created this distribution of pain from the various facet joints. As we can see, the facet joints refer pain in very similar patterns to what is seen in whiplash patients. In 1997, the Australian researchers published some of the most dramatic evidence that whiplash pain is related to injury to the cervical facet joints. In this study, Wallace et al. Decided to study the effectiveness of radiofrequency neurotomy, a surgical procedure that literally cooks the nerves that innervate the facet joints. 17 patients with long-term chronic whiplash pain were randomly given either the real surgical treatment or a sham treatment. 9 patients received the real treatment and 8 received the placebo treatment. The patients were then evaluated 3 months later. Wallace et al. Found that 67% of the patients who received the actual treatment reported complete pain relief. Only 38% of the patients who received the placebo treatment reported complete pain relief. Clearly, the real treatment seemed to relieve the symptoms at a much greater rate than the placebo. But the most remarkable finding was this. In every single one of the patients who reported complete pain relief from the real treatment, there was also a complete and immediate disappearance of the psychological symptoms that these patients had been reporting. The authors of this study wrote, "Somatization, obsessive-compulsive behavior, and depression can readily be seen as rational psychological responses to persisting pain that medical practitioners have not been able to diagnose and treat, and which has been attributed to malingering. These rational responses should disappear if the underlying pain is successfully treated. This is what occurred in the present study." So not only did this study show that the facet joints play a strong role in the issue of chronic whiplash pain, but it also demonstrated that the psychological distress that so often accompanies whiplash is a result of chronic pain, not the other way around.